Hi guys, I'm Dr. Aheli Pal. I'm an oral surgeon.
I'm Dr. Trunaya Bhatlekar. I'm a prosthodontist.
And in September, we celebrate National Dental Implant Awareness Month. So today we are going to have a discussion from an oral surgeon to find out the prosthodontist point of view in dental implants. So doctor, what are the biggest challenges you face in the prosto part for dental implants?
So when it comes to restoring dental implants prosthetically, for doctors as well as for the patients, the most common challenge that they face or they ask doctors is that how do you maintain hygiene of the restored implants? And one thing as doctors, as restoring implants, we need to take care is that the soft tissue around the restored implant needs to be thick enough and the width of the attachment java has to be optimal so that the patient can maintain good care of the implants and also the longevity of the treatment is ensured. So for this thing, we need to, before placing implants only, plan about any soft tissue augmentation that needs to be taken care of, which could happen during implant placement or even after restoring implants. It could involve your connective tissue grafting or free-gingival graft, or it could also be use of any collagen membranes during implant placement. Then the second thing that comes into play is the cantilevers that happen during the prosthetic replacement or the prosthetic restoration. This is again directly connected to the angulation of the implants. So we need to take care that the mesiodistal centering, the buccolingual centering during implant placement needs to be taken care of, and also the force vectors that happen due to the implant angulation need to be again. It is one of the concerns. So one easiest hack that we can follow is that during implant placement, the head of the implant needs to be pointing in the direction of the opposing tooth functional cusp. That's one tip that I can put it out there, so that this again ensures good prosthetics and easier restoration and again lasting of the prosthetics for a long time.
What do you have to say about abutment selection to mitigate such problems?
So usually abutments, there's a variety of abutments that's available for use actually. The normal straight ones that we use is for restoring single unit implants, the straight hex abutment. Then if there are multiple implants, like maybe 3 or 4 implants that you need to restore and the prosthetics is splinted, then you can use the non-hex ones. Angled abutments usually are used when the implant angulation itself is like when there are multiple implants and they are not parallel to each other, or especially in cases of immediate implants in the maxilla when the angulation is slightly lingual as normal, and in such cases you need to use the 13 degree or 15 degree or 17 degree angulated abutments. And again, there is something called as multi-unit abutments. So the multi-unit ones are used in full arch prosthetics when the single arch or multiple both arches implants are restored using a single unit prosthesis and the screw implant. So again, it's easier for fabrication of the prosthesis and maintaining it.
Okay. Thank you, doctor, for your tips and especially the hack. And if you have any further questions you want to ask either of us, please comment below.
Thank you.